This episode of Ask the Doctors is being brought to you by Wayne County Government.
I'm willing to take the shot.
I'm willing to take the shot.
I'm willing to take the shot.
I'm Dr. Bandari, physician at Reed Health. I'm willing to take the shot.
I am willing to roll up my sleeves and take the shot. Are you willing to take the shot?
We are willing to take the shot.
What is your name?
Eric, E-R-I-C, Marsh, M-A-R-S-H.
Have you ever had a reaction to vaccines before?
No.
All right. Which arm would you like today? Hold on.
That was it?
Yeah, pretty
Cool.
fast, huh?
Yeah.
All right. I'm gonna give you a 15-minute timer, and we're gonna sit out here. They'll schedule you for your next appointment, okay?
Sounds good.
This is your vaccination card. Bring that to your next appointment.
Okay.
And this is something to read about the vaccination you received from Pfizer today.
Okay.
All right. Thank you so
good.
much. We'll see you back in 21 days.
Thank you very much.
All right. We're gonna go out here.
Yeah, I was one of those people who said I was willing to take the shot. They dropped the number to age 60 on Tuesday, and Wednesday I was getting a needle in my arm. Okay? Time to get it done. Welcome to Ask the Doctors on Whitewater Community Television's WGTV Channel 11. I really wasn't sure we were going to air that, but the doctors had been the first ones to actually do it on the air, so I figured I should probably at least join in. Our doctors, as always, Dr. David Jetmore, Wayne County Health Officer. Sir, how are you today?
Always a pleasure, Eric.
Dr. Thomas Huth, Vice President, Medical Affairs, Reed Health. Once again, good to see both of you.
Thank you.
It's been a week. We do have on Zoom, and we will be bringing her in just a few minutes, Christine Stinson, Executive Director, Wayne County Health Department. It's been a good week. The numbers continue to decline, although we are still getting some cases. I understand the Health Department doesn't have an appointment left till mid-March or something along those lines. Is that what I'm hearing?
Yeah, that's right. I think Christine announced that in a news release the other day. But she did say you could get an earlier appointment at the Reed site at the Kuhlman Center. So, you know, whatever you can get in first is the one to go to. But as we open this up to lower age groups, we're having a tremendous demand. That's a good thing. We want people to come in and get vaccinated. The vaccine itself does no good. It has to be in somebody's arm. But as you said, we are having our numbers fall. The vaccination rate is increasing. I think the number of people in Indiana that are fully vaccinated is close to 500,000, and close to 1 million people have had the first shot. So those are all encouraging numbers. And the pandemic is currently in a trough phase rather than a peak phase, so that's a good thing.
Okay. How's your week been? More people at your facility able to take a little time off, get some rest, catch up a little bit on life outside of the hospital?
Some, I hope. The team that are working on vaccinations, we've actually been meeting quite a bit, and with local health departments, with other partners in the community, looking at ways that we can continue to expand our outreach for vaccination. We happen to have a really good supply of vaccine right now, and not only do we have a lot of open appointments on our schedule, we have enough vaccine, and we think we're going to have access to some additional supplies that we're looking to work on some outreach opportunities. We spoke with Christine this week about taking the last little bit of Moderna that we have left and going out to do some basically pop-up vaccination at some strategic places.
Nice.
And we may do that with our Pfizer supply as well, possibly. And so we're looking at opportunities to kind of get outside the four walls of the Kuhlman Center and go to where people are who would like to be vaccinated but can't make the trip.
Why don't we, Ryan, if you don't mind, I know there's information where people can go so that they can get registered for a shot. Why don't we put that up pretty early so that we know for Reed, because we want to make sure that folks have a way to be able to reach them. Obviously, ourshot.in.gov, and I will say that I made my appointment. I wasn't on a computer. I did it on my smartphone, and it was really pretty quick, really
easy.
pretty easy. I was able to enter all of my information. It took 15 minutes, and I was kind of doing it in tandem with my wife, who was on her smartphone at the same time, kind of doing it. We could have probably done it a little faster if we'd been working solo, but we were making sure we were about on the same page. Yeah. So it does go pretty quickly. And we did hours in the evening, I'll say. I know that some people have said maybe getting it during the day when other folks are trying to do it. It's been a little bit more difficult. We were sitting there at 10 o'clock at night watching a rerun of Bobby Flay or something and just kind of getting into it.
Yeah, if you're handy with your phone like you are, Eric, or the computer, ourshot.in.gov is a great way to do that. You look specifically for the Wayne County Health Department or the Reed Kuhlman site, and if you happen to be in one of the surrounding counties, Fayette County or Randolph County, there are also local health department opportunities there, but everybody anywhere is welcome to come to Kuhlman Center, and so always look there. If you're not handy with the computer, we recommend calling the Kuhlman Center, 935-8484, rather than using 211. And the 211 people are nice and everything, but the trouble is they seem to not always give the most accurate information. It's some issues with the scheduling software as they see it, so it's not their fault. But if you want the best, most accurate information and kind of get directly to the source, call the Kuhlman Center, 935-8484.
Okay. We are taking your questions for the doctors. You can put a question on our Facebook page. You can send a question to Twitter at WCTV Info, and we will be getting to some questions for the doctors coming up in just a few minutes. I want to bring into this conversation very early Christine Stinson, Executive Director of the Wayne County Health Department, because obviously she was the one who kind of helped release some of the information that the color coding map for us looks a little better down at blue, yep. Which, 6-8 weeks ago, we weren't sure how soon we were going to see that. Christine, how are you?
Well, yeah, I'm good. Thank you guys for having me on here. I appreciate you giving me the platform to get the good news out. It's a nice change of pace to be given good news about Wayne County. 6-8 weeks ago, we were wondering if we were going to go red, and we were always able to maintain that orange level, and we never went up into the red numbers. And now we're in blue, which is the best color you can be in right now. Our advisory level hasn't reached the blue level yet, so we're still in the yellow level of restrictions. But I anticipate on Wednesday we will be in that blue level of regulations and restrictions, which are a little less than what they are right now. But always remember, masking and social distancing is always a part of that.
Talk to us a little bit about when it becomes official, what changes? What will people see? What will people be able to do? Where will they be able to go that will make life seem a little bit more, almost hate to use the term normal, but that's where we'll go for them?
Well, under the blue level, we go to 100% capacity for spaces. But the thing that will drive the occupancy will be the size, because that social separation of 6 feet is still a requirement. So event spaces may be open at 100%, but they won't be able to get that 100% capacity because that restriction of the 6 feet separation is still part of that. So events and things open up to 250 in attendance if we go blue for 2 weeks in a row. I anticipate that we will, although our numbers are a little noisy. We're seeing some cluster cases. So I am reserved in my excitement because it could always change. We're in a very tender and fragile time right now. I'm optimistic that we'll stay blue, but there always is that chance that we'll stay in a yellow level advisory. But remember, social distancing and masking is part of any of the restrictions. That has not been lifted.
What happened that your site was able to fill as many of its appointments as you have, leading almost 2 weeks out, which was unheard of again just a couple of weeks ago?
We have a very limited supply of doses. And so with only 600 doses a week, our site gets filled up very, very quickly. And we always refer people, you don't have to wait. Of course, we would love to be vaccinating thousands of people a day, but don't wait to get to our site. You can go to the Coleman Center and get in mostly that day or at least the day after. If people call the health department, we also assist with scheduling, and we schedule a lot of people to go to the Reed site out there at the Coleman Center. The only difference is we do Moderna, they do Pfizer. Both are the messenger RNA, but I think that there are some people out there, for whatever reason, maybe their family has had Moderna, so they want to all kind of stay with the same type of vaccine. So they want to wait until the Moderna appointment opens up. And that's absolutely fine, as long as we're all stepping forward to take our shot when it's our turn.
Well, Christine, great to see you. I love that mantle that's there behind you.
Yeah,
looks like
thank
a nice
you.
place,
I'm at
wherever
an
that is.
undisclosed location today.
Have you heard anything about Johnson & Johnson? That we're expecting that to be emergency use authorized today, possibly.
I've heard it's tomorrow that they're looking to that it will be. I have kind of seen a timeline from the state that they expect that to go through for it to be approved. They're not seeing any hiccups or anything in that. And then starting around March 2nd or 3rd, Johnson & Johnson will be released out to the states. I have not heard how Indiana is going to get it out. Will the health departments have some to do outreach or anything like that? So I'm expecting on our Monday webinar that we'll get a lot more direction from ISDH on that.
Yeah, I can only just speculate a little bit. I mean, we heard from Dr. Weaver a day or two ago that they were thinking Indiana might get 40,000 doses, something like that, which sounds like a lot of doses, but spread around the whole state. It's not very many per site. Right. There are a couple of particular things about the Johnson & Johnson vaccine. One is that it's a single dose, which is awesome. That would make things a lot easier. On the other hand, the efficacy, the effectiveness rate may not be quite as high after that one dose than the Pfizer and the Moderna are after 2 doses. And what I detect is that there's discussion around whether maybe, as long as Johnson & Johnson's limited supply, maybe that should be sort of targeted at some populations where, you you only kind of get one opportunity to get to them. It could be people who are more indigent or who maybe, use emergency rooms or urgent cares for, it's kind of like as their primary care, and otherwise they kind of get lost to follow up. People, and there are a variety of situations where it may be hard to get people for a second dose, in which case maybe doing the Johnson & Johnson would be a good targeting of that. But I don't think I've heard too much on, exactly, that the state hasn't said exactly how they want to do that.
Yeah, I'm excited to hear from the state how they see it's going to get distributed out. Of course, we've raised our hand and said we would love to be one of the sites that have Johnson & Johnson, because I see a definite need and a hole that Johnson & Johnson can fill. And I think that it's funny that we're talking about the efficacy like a poo-poo to Johnson & Johnson because it's got a 66% efficacy. That is a wonderful vaccine, and it definitely is better than nothing. And I've heard some stuff that it gets up into the 86% if you're looking at keeping people out of the hospital and death from it. So we get a little higher when we're looking at what we really want to do, which is keep people out of the hospital and decrease the death due to COVID.
That's a good point, Christine. I mean, in normal times, if you have a vaccine that's 65 or 70% efficacious, I mean, you click your heels. That's a fantastic vaccine. And it's almost unheard of to have two vaccines that have 95% efficacy. And I read the other day that the European Union gave over 1 million doses of AstraZeneca to Germany, and the Germans weren't wanting to take it because it wasn't as efficacious as the Pfizer vaccine. Well, it's a fine vaccine. They should take it. But out of that 1 million doses, I think only about 200,000 have been taken.
You're going to start getting questions, if you haven't already, about suggestions for spring break, travel, what people should be thinking about, how they should be handling that, and probably in a pretty quick turn, I assume, as you all have stayed in contact with the schools, questions are going to start coming up about what they're going to do about graduations, commencement ceremonies, which were all up in the air last year. What are the rules of the road that you're suggesting at this point, knowing, we just talked about 6 weeks ago, we didn't think we were going to be at this point. We don't know for sure where we will be in 6 weeks. But what are the rules of the road? What should people be thinking about? What should people be planning right now?
We're still asking people that travel is not advised. And I hate to be the wet blanket, thrown on everyone, but the state does say don't travel for spring break. Then if you do, a 2-week isolation coming back is something that they would ask that you do, although there's not a requirement that you do that. So that's kind of what I've advised the schools. I'm in very close contact with the schools that they should talk to families about this, limiting your spring break travel. If you do travel, maybe isolating for 2 weeks when you come back, making sure no one has any signs or symptoms of COVID when you come back. But that's up to the schools on how they want to. I don't think Dr. Jetmore or myself is looking to impose that anyone that travels during spring break has to stay out of school for 2 weeks following that. That could change, depending on what anything looks like, during spring break. But yeah, we've gotten the calls about, what's graduation going to look like. We're advising people to plan outdoor events. Outdoor events are always safer than indoor events. How can we pod families together and then keep that separation between, attendees and, anytime that you can live stream events to keep people from coming to the site. So the plans are already starting to go into place on what we can do to have, some kind of graduation ceremonies, but I think that they'll definitely be outside.
Any fears about spread, considering the fact that Indianapolis is going to be hosting the NCAA basketball tournament coming up here? They will be allowing fans, and more venues are beginning to allow fans in. Any concern from any of you all about the traveling of folks into the state and what that means? Because we're going to have people coming to this state in order to be able to do that. And, you know, if my family was coming from Chicago to watch a basketball game in Indy, you can believe they'd probably try to make the 1 hour trip over here to see me. So you got to figure a lot of families are going to do that. What, again, should people be aware of? What should they be thinking about?
Well, I definitely think that we're all kind of concerned that as the numbers are getting better, everyone is kind of relaxing down our guard and wanting to rush back into life before COVID. And I know that I've noticed a lot more people maybe not adhering so closely to the masking when they're just running in maybe to the gas station or something like that. Although I'm really happy when I go to the grocery store, people are always wearing their masks. But we need to remember these are the things that can help us prevent going into another big surge again, is those things that we've put into place. Wearing your mask when you're in public spaces, washing your hands, and maintaining that 6 foot separation. But yes, I am concerned about the big basketball events coming up.
Christine, we're going to let you go, but I need to check on something because we kind of let the conversations go and we don't always circle back to things. You were asking, and the health department had asked for some volunteers and some help, I think, with contact tracing and medical professionals, I assume, who could maybe give shots when more of them come up and you're trying to do some of the mobile unit type of things. Are you still in need of volunteers? Are you still in need of that help?
No, we have a really good group of rostered volunteers. We've trained the medical ones to do the shots, and just as soon as we have the vaccine, we're ready to go. And we have been in discussion with Dr. Huth on doing some outreach, and really excited to be able to do that, maybe even starting as early as next week.
Okay. Christine Stinson, Executive Director, Wayne County Health Department. Before I let you go, is there anything that we haven't asked you about that you want to make sure the community is aware of?
I don't think so, Eric. As always, you do a very good job of covering all the bases.
Thanks, Christine. I appreciate it. I appreciate the time always.
Yeah. Thank you, guys.
Christine Stinson, Executive Director, Wayne County Health Department. Again, you may not be able to get into the Elder Bierman site to get a COVID shot, but there are plenty of openings out at the Coleman Center where Reed has their vaccination site. And if you are in need of transportation there, check in with Roseview Transit. I believe it is their number 5 bus route that is providing free transportation if you are getting a vaccination shot at the Coleman Center, and if you need that transportation, that information is there on the screen. A couple of phone numbers, 983-7227 or 983-7301. So we don't want transportation to be a reason you're not able to get this done. So that's just one of the things that are there.
Eric, if I could jump in on the Roseview thing, I think that was a good segue to something I'm grateful about is how quickly the city and Roseview Transit reacted to the request. I think they eventually got that set up and running within a couple days of the request, which is a little bit unusual for government bureaucracies to do. So kudos to the city or whoever was involved in that. I know that Sherry Harlan Davis from Reed was involved in that, and I'm sure a lot of other people were as well, but it was really great to see that happen so quickly.
Okay. And hopefully you're seeing folks come out on the bus and
definitely
are able to get there. This is Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, streaming on Facebook. You can put a question in to our Facebook page or to at WCTV Info. Let's see if we can get a couple of questions answered. Can people get COVID more than once?
I think we believe that they can. We don't understand all the reasons behind that. There might be some differences in the virus, genetic differences in the second virus compared to the first, or there may be incomplete immunity or lower level immunity from the first infection. There are a number of potential factors, but I think we don't understand very much about why and when that happens, but it's pretty rare for people to get a second infection within about 90 days of the first, apparently, and we think that that'll certainly be the case with the vaccines, and to my mind, the vaccine preventative effect will be a lot longer than that, but we don't know these things for sure yet. But yeah, you can. It's unusual, but it can happen.
I think some people have reported with some of these newer variants of the virus that a reinfection might be more likely. However, I think you need to echo Tom's point, is it's very unusual to get COVID the second time.
Okay. Next question. Are there any vitamins or natural remedies that you could recommend to help boost my immune system?
I'll take a first shot at it. Maybe Dr. Jetmore has other ideas. There are some things that we commonly find recommended. I'm not going to say that I recommend them. I don't have a problem with them, but I don't really know. I think the science is really incomplete on it, but some things that you find commonly recommended are just standard multivitamins, particularly B vitamins, vitamin C, zinc, and vitamin D3. I think the one that's probably the best studied of those is the vitamin D3, and even that's pretty incomplete. And what we do know is that at least in hospitalized patients, adding vitamin D3 to the regimen doesn't really hurt, but it doesn't seem to help. Doesn't seem to make a difference. So for what that's worth, there's no problem with taking those. They're low risk, low cost, but I don't think we should count on those to protect us. We still have to do the normal things. The only other thing that was on our list, the question was specifically about minerals and vitamins, so I answered it that way, but there is an additional over-the-counter medication that some people believe may have some preventive effect, and that's the trade name is, or the generic name is Famotidine. One of the trade names is Pepcid. It's a stomach acid reducing medicine. Why that should have any benefit, we don't know, but there is an association between taking that and having lower severity disease. But here again, where it's been studied in prospective trials where they give famotidine to people who have COVID-19 in a hospital, it does not seem to have any benefit one way or the other. So that's about as much as I know, that I think we know. Perhaps Dr. Jetmore knows something else.
Well, I don't think any of these things are going to boost your immune system. And just because I haven't seen any real valid scientific study that seems to prove that, having said that, none of these things are going to hurt your health. They're not expensive medications, but I don't take any of them myself and don't plan to start anytime soon.
Is it better basically just to eat a healthier diet, try to exercise, and get some rest?
Well, I think I'm doing a controlled study where I drink about a thumb's width of bourbon each evening when I'm not on call to see if
I'm glad you threw that last part in there.
To see if this won't help my immune system. It's a very informal study, Eric.
Okay.
But I'll get back to you in a couple months with my results.
How big is that thumb?
That's the thumb width, not this way. It's got.
Okay. I was. Never mind. Next question. We should probably move on. In the beginning, asthma was considered high risk. I no longer see that it's high risk for eligibility for the vaccine. If it's primarily a respiratory virus, why isn't asthma being considered?
I think if the question is about eligibility for vaccine, right now we don't really have any eligibility factors on comorbid conditions, just to make that clear. Right now in Indiana, it's strictly on age, but that may change, and I think that the medical risk groups will initially be focused on people with cancers and a little bit more serious chronic disease than asthma is. I mean, not that asthma's not serious.
It wasn't that originally listed as one of the initial comorbidities. I mean, along with hypertension, diabetes, wasn't asthma listed along with those things?
You know, I guess I'd have to go back and research that. I think I kind of got lumped into, you know, people with chronic respiratory illnesses, and the first thing you think of is asthma on that. I think there may, my feeling is that there is some association, but that alone is not as high a risk factor as some other things.
Okay. We're taking your questions. Ask the Doctors on Whitewater Community Television's WGTV Channel 11. Send your question to our Facebook page or Twitter at WCTV Info. Our doctors are Dr. Thomas Huth, Reed Health, Dr. David Jetmore, Wayne County Health Department. Let's go to another question. It has been reported that some hospitals have given vaccines to board members or officials before qualifying for them, I guess before the officials qualify for them. Has Reed held strictly to state guidelines, I assume?
Well, let's maybe parse this out a little bit. We don't have secret lists and special VIP administrations. But what we do have is we've kept an informal, it's kind of a standby list for use for when we have extra vaccine if we need willing arms to take it. And then in addition to that, recently we had a certain amount of vaccine that was going to expire within a couple days, and we didn't have enough appointments on the schedule filled to be able to use that. And with the state's permission, we opened it up for the number of those extra vaccine doses that were expiring. We opened it up with the state's blessing to Reed employees and board members and such who were family members of Reed affiliated folks. And that was just because that was the easiest group to get at on very short notice, because we needed them to take it that day. And it was in the middle of the snowstorm, and everybody was having trouble with transportation and so forth.
I
So
remember
there was
that
a special
episode.
situation.
You became aware of that just like within 24 hours of having to either use this vaccine or have it be totally wasted.
Yeah, I mean,
So you had to come up with a large number of people that all of a sudden were willing to take this vaccine.
Exactly. And so we contacted the state and said, this is the plan we want to do, and under the emergency circumstances, they blessed that. But we shut that off as soon as the extra doses were all gone, and that's what it was. Now, I've been thinking about this wait list thing. We've always had a few people, who've been able to call up and say, hey, I got an extra dose. It's 6 p.m. We're closing in, 1 hour. I'm going to have 2 doses. Can you please come right now, get a shot? I think what we want to do is, and my team are probably going to want to wring my neck for mentioning it now, but we're working on a system where, this should be more equitably available, that access. Mm-hmm. We can't just, the state has also been vocal, I should say, that even standby lists need to be carefully managed so that you don't wind up vaccinating people who are not even close to being eligible by the state's guidelines. And so we're working out a system right now. How can we do that in an equitable and fair manner, make it available to everybody through like a form on the website, which is what we're working on, to be able to get on the list. And probably what that will involve is, anybody can get on the list, but if you don't meet if you're not in the next identified group to be, that we think the state is going to soon reduce the eligibility to or change the eligibility to, if you're completely outside of that, you can still get on the list, but you will be in the emergency use only. So in other words, you'll be prioritized lower, so that if we go through the people who are closer to being eligible and we don't have any takers, then you could be on a list where you can get access that way a little bit earlier. That's the only way I can think of to kind of make it fair and equitable for everybody and not get the state concerned about how we're managing the vaccine supply because there have been other hospitals and health departments around the state who have innocently thought that they could, have a lot of people sign up and just, come up and get shots kind of out of order. And the state gets a lot of blowback on that from other people in the public, so they're really asking us to rein that in. So we're going to try to meet somewhere in the middle, but whatever we put together will be completely with the state's blessing, and it'll be fair and equitable for everybody.
Well, you have to have a list because the worst thing you can do with this vaccine is waste it. I mean, that by far is the worst thing you can do. But as soon as you make a list, it becomes, to some degree, inequitable. I remember when we first put together our list, we tried to find people that were not 80, but were sick, that had a history of heart attack or stroke or barely controlled diabetes, but that became inequitable because the people I put on the list were people I knew. If I didn't know a person, they didn't get, and Christine and some of the other people in the health department put people on that list too. That was what we did initially. And then it becomes hard to manage a list, as you alluded to, Tom, because people get shot, they get eliminated, the list needs to be replenished. At one point, Christine and I innocently thought, well, we'll just vaccinate the teachers with these extra doses. There'll be 2 or 3 doses a day. Well, that was not met with approval by the state. I mean, we were chastised for that and told not to immunize the teachers. So we're back to trying to get people that are ill, have a lot of associated conditions, but don't quite meet the age opening on the list. So that's how we put together our list.
As the ages continue to drop, this problem will begin to work itself out even a little bit more, I assume. I mean, by the time we get to 55, 50, you're going to be able to wrap a lot of people into these emergency lists that you're trying to do, because you're right, wasting something that's in short supply that a lot of people are looking for can't be where you want to be.
That's a catastrophe, wasting even one. We've never wasted a single dose. You probably haven't either.
No.
But it's been because of this vigilance.
Okay. Now you're going to get a lot of calls.
Probably, yeah. Like I said, my team is going to want to wring my neck because we don't have this worked out yet. So don't call yet. I have a feeling that by probably like mid next week, we'll have this ability available to everybody.
Cool. You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, streaming on Facebook. We are still taking your questions. There's time to get it in on our Facebook page. Also, by tweeting to us at WCTV Info. We're going to check Dr. Huth's numbers here, which hopefully there's a big green blob on the middle of my page, so that's green has got to be good. So we're going to get to that, but first we'll see if we can get a couple more questions in. What would happen if you get vaccinated while being asymptomatic with COVID? I assume that's probably happened, hasn't it?
I'm sure it is. By definition, it's probably something we wouldn't know. An asymptomatic person. If somebody knows that they're recently positive, they need to get through the isolation period before they present for vaccination. So we don't want to vaccinate people who are known to be actively ill, and that's not because there's danger to them. It's because we don't want people who are actively ill coming into our vaccination center who are known to be. So we try to prevent that as much as we can. But having said that, we know that there are a fair number of people who contract the disease and who remain asymptomatic throughout. That certainly can happen. And that means probably some of those people are going to come in and are going to get the vaccine. There is no ill consequence to that. And so it's just not really a concern. It probably neither helps nor hurts in terms of, the immune reaction that we're looking to get.
They're going to still end up with a valid vaccination, even though they presented with asymptomatic COVID.
Okay. They mentioned asymptomatic, and we mentioned it a few weeks ago, testing numbers, are those still where you want them to be or where you feel they should be? You all are still you're running a vaccination site, you're also running a testing site. Are you seeing as much through one door as the other, or is the vaccination well outpacing the testing, and is that a good thing?
Well, the vaccination's outpacing the testing. It's good that the vaccination, we need to have more vaccination, and we need to have more testing. You can never have enough testing. The testing tells you the penetration of the virus into your population. So, but we're having less testing because we're having less people who are symptomatic, and that reflects on our incredibly low positivity rate. I think it's 3.7% now for the county. So I'd like to see testing up, and I'd like to see vaccinations up.
I think if it were a decision between, you can either have high testing or you can have high vaccination. Well, I think we'd rather have the high vaccination, right? But we can be okay about lower testing levels, even if we prefer they be higher, because the positivity rate is lower. So to me, what that means is that there is less disease in the county. And if it were just people were sick but not getting tested, we'd be more concerned. If the positivity rate were high, if the only people who bothered to get tested were those who had symptoms, then we have a very high positivity rate, right? And that's not what we would want to see happen. We like having positivity rates below a certain amount, and we're at a comfortable place right now, I think.
Mm-hmm.
Okay. Testing is still available, and we will put that information up here in just a little bit, but we're going to get one more question, and then we'll turn to Dr. Huth for some numbers. So next question up. Could you still be a carrier of the virus after receiving the vaccine?
That's one of the $64,000 questions. The honest truth is we don't really know very much about that. I did see one study earlier this week that was released, and it had to do with the AstraZeneca vaccine. So that's not quite the apples-to-apples comparison, but there is some evidence with that vaccine that actually transmission by people vaccinated is lower. It's not gone, but it's lower. So hopefully that's directionally where we want to be. But I think we have to consider the possibility that even if you're vaccinated, you could still be a carrier. We have to assume that for now. Hopefully that will, after time and study, will be less of an issue than we think. But I think that's what's behind. We're still going to have to, mask and distance and so forth for a while. One of the reasons why.
Yeah, that's the reason why we can't throw our mask away when we get vaccinated, because we may still be able to carry the virus and infect others. So we're going to have to soldier up and mask up until we get through this.
Getting through this, just as a question, we've heard from the beginning, for various reasons, the term herd immunity, which is somewhere between, 70 and 85%. Is that close enough? The number keeps changing.
I think it started out at around 60 or 65 a year ago, and it's inched its way inexorably upwards until it's approaching 80%. But I think this is going to be over when you have, a positivity rate of a fraction of 1%, and a great majority of the population has either had the disease naturally and has natural antibodies or has been vaccinated. One of the things we're going to have to deal with before this is all over is vaccinating all of our young people that are younger than 16. And I think both Moderna and Pfizer are doing clinical trials for down to age 12. But we've got these huge pool of people, and without those being vaccinated, you're never going to get up to 85%. Mm-hmm. So that'll have to be dealt with before this is well, I keep saying before it's all over with, I don't know if it ever will be all over, because I think this virus, I'd be interested to hear Tom's thought. I think this virus may linger as a seasonal infection for maybe years to come.
I can't disagree with any of that. I think we just don't know the future on that. Before we went on the air, we were discussing, with the numbers coming down, where does it go from here? And you used the term, we're in a trough, or maybe you did that after we went live, I can't remember. But I think that's the perfect description of it. We're in a trough right now, so we don't know. Does that mean we're bound to go up? There's an article in today's New York Times about the reasons to expect that there may well be another wave, and it has not everything to do with masking and distancing and vaccines, although those are part of the reason. But there are things we don't understand about the natural cycles of this kind of illness, because we haven't had one of this dimension in over 100 years. And so none of us have living memory of that, and it's just not something we go around with a clear picture of. So, we may see more waves. Hopefully they won't be like this last one we went through. And, so with that in mind, the jury is out on how long we'll have to continue to mask.
Do you see it still probably being necessary into the fall?
Well, the optimist in me wants to say, hey, you know what, if our rates continue to be low, the whole state, much of the state, or all of it goes blue on the state map, and stays that way for long enough, maybe the governor will feel comfortable to start relaxing some of the restrictions, and maybe in some places, under some circumstances, masks won't be necessary. But I don't think we're going to reach a point where one day no masks are necessary. I kind of doubt that in Indiana or in Ohio. That's kind of my feeling, but as far as putting a time frame around it, really hard to say.
I think a lot of it depends on the vaccine rollout, Eric. I think if people are willing to take become vaccinated, if we continue to have, I'm sure Pfizer and Moderna will continue to increase their production. Johnson & Johnson's coming online. There'll be other vaccines coming. I think, the government's talked about 300 million doses in arms by June or July of this summer. If that's the case, then I see a dramatically different latter half of the summer and early fall than what we've got now. But I agree with Tom. It's not like, well, it's really dangerous today, but tomorrow we can all take our mask off. It's going to have to be a gradual thing.
Okay. Let's find out. We've got about 8.5, 9
Sure.
minutes left. Let's find out how the numbers around the county are looking. We mentioned that if we can get to Wednesday in blue, we get to stay there, but that's not the whole story.
Okay, well, I've changed the look a little bit, and the blue curve, as we can see, is there, and it's something we've been looking at. The last bar on the right, way down there, kind of got to squint a little bit maybe to see it, or get your magnifying glass out, or Ryan can magnify in. So far through yesterday, the county's had 46 cases, and a lot of that was a big bump on the day before that on Wednesday. And that throws the projection up to about, we should end the week about 64, which, if so, will be a slight increase over last week. But I don't think that implies anything about the trend down. We'll just have to see how things go in the future. The inset graph over on the left is a different way to represent the actual deaths compared to what would be expected by the demographics of our cases. And anything less than 1 is good, so that's why it's green. So it's the actual or observed to expected ratio. Basically, what it's saying was we've only had about 94% of the deaths we should expect to have. But I would note that actually has been increasing. A week or two ago, we were at 89%. But I don't know if that's just maybe something that comes out in the later stages of an epidemic where the active cases are down to those who are more frail and so forth, and you're going to maybe see some continuing deaths out of that. So I'm not panicking, but it is changing. The second page is the Reed graph that is, in a way, is a mirror of that. And down on the right-hand side, we can see that the active cases in Reed have declined. Today, we had a total of about 20, I think the number was 24 in isolation. What you're seeing there is the average so far for the week. So those numbers have been declining. And this is the second week in a row where we'll have had no patients on ventilator, which we haven't had 2 weeks in a row like that since the beginning. That's our numbers.
It's good news.
Yeah, it is very good news.
We've probably got about 7 minutes or so left. I'm going to see if we can get through at least a couple more questions to wrap up this week. So let's see what we got. If all of my family is here in our area, they came in for the basketball game. If all of my family is here in our area, have been vaccinated, and family from out of the state wants to visit over Easter, is it safe? They don't want to be vaccinated.
Well, I don't know why they don't want to be vaccinated. I mean, that's
I've got a sister that doesn't.
well, I guess having said that, I've got a brother that doesn't want to be vaccinated. But if you've got family visiting, they don't want to be vaccinated. No, it's not safe.
Next
Do
question.
you have anything to add to that, Tom?
Not really. I mean, maybe it. I have a lot of siblings. I'm one of 7, and I'm with the spouses and everything. I haven't asked any of them, so I won't be surprised if some of them aren't going to get vaccinated either. But, I think it depends a little bit on the circumstances, possibly. If I'm in a more at-risk age group and they're coming in from out of state and don't intend to be vaccinated, and maybe they don't take many precautions themselves, then maybe even if I've been vaccinated, maybe it's not as safe as it could be, and I should be think how we're gonna manage that situation. I don't want to tell people not to do things, but you got to consider all the factors and make wise choices, and not just throw everything to the wind simply because we desperately want to have this family gathering.
Okay. Next question. I hear a lot of good news for Wayne County. I'm also hearing school proms have been canceled, but in-person school is back in. Can you explain that decision, please?
Well, I think school is back in because it's safe for kids to be in school. We've followed this all year long. We've looked for any outbreaks in the school to try to trace it to intra-school transmission. We've not found any. We've found children have gotten COVID, but it's been in an outside environment. Now, I haven't really thought about the whole prom question, but a prom is different. I think, you got to remember when you're having class in a school, people are wearing masks and distance at 6 feet, and it's a very controlled environment. A prom, at least a prom as I remember it in the dim recesses of my mind, involves dancing with young girls and socializing with people, which is the exact opposite of the situation you have in a classroom. So I see that as being the principal difference between how you would maybe allow one and not the other. And I don't know that there's been a decision made by the school on proms or not, but I would think it would certainly be difficult to have a traditional prom in this environment.
I've not heard if schools are canceling proms. I hadn't heard that. But, it kind of makes sense in a way because I would put the prom activity kind of in the category like other extracurriculars like the sports and the cheerleading, some situations we've heard about where, on the one hand, schools in general have done great, particularly in classroom. There's, really well managed, but where there are hot spots, it tends to be around those extracurricular, especially contact sports situations. And I suppose we could consider prom a contact sport.
It is.
I'm told by the voices in my head that if you tune in to a program called Let's Talk on Tuesday, March 9th, 7 o'clock on our Education Access Station, a couple of the superintendents actually kind of talk a little bit about this particular issue. Let's Talk is a program that we've been running for a few years. There's normally 3 programs, various topics. COVID comes up a lot this year, and a couple of the superintendents are talking about that, so just to know that. We're probably 2 minutes, so we're probably not going to try to get another question in. We had a couple left that I was going to try to get in, but I think the prom being a contact sport thing kind of threw me off, and we'll just let that kind of walk. So we will say, gentlemen, thank you very much, Dr. Thomas Huth, Vice President, Medical Affairs at Reed Health, and Dr. David Jetmore, Wayne County Health Officer. Once again, we really do appreciate your time every week coming in to answer our questions.
It's our pleasure.
Thank
It's
you
fun.
for
Thank
having
you.
us, Eric.
There are a couple of things I need to tell you about. There is testing. I mentioned that we would bring up information on testing sites because testing is still available, still the 2 locations. The old Elder Bierman site is still available, 8 a.m. to 6 p.m. It is a COVID vaccination site, but it is also still a COVID community testing site. So check that out. And also Cambridge City's location is still available, and that is at 138 West Main Street, and that is open Monday through Friday from 8 a.m. to 8 p.m. Let's go to whatever next. Reminding you that you can still get a COVID vaccine if you get to the Coleman Center. That is Reed Health site. Information on that there on the screen, ourshot.in.gov. And as opposed to calling 211, which you will find on some things, it probably is better to call 935-8484 to get some help with that. And again, if not going out to the Coleman Center is a problem for you because of transportation, then you should be getting in touch with Roadsview Transit because they may be able to help you with that transportation problem. If you've missed parts of this show, it will be replayed again this evening and throughout the next week. Thanks for watching this week's edition of Ask the Doctors on Whitewater Community Television's WGTV Channel 11. As always, I wish you well. Put your mask on, get out, and enjoy the weekend. The weather's supposed to be great. This episode of Ask the Doctors has been brought to you by Wayne County Government.
I'm willing to take the shot.
I'm willing to take the shot.
I'm willing to take the shot.
I'm Dr. Bhandari, physician at Reed Health. I'm willing to take the shot.
I am willing to roll up my sleeves and take the shot. Are you willing to take the shot?
We are willing to take the shot.
Shot.